Hi, everyone. Welcome to our webinar. We are going to get started. I just want to confirm that everyone can hear me. And if you can, type in the chat box where you are listening in from. Oh, wow. Great representation. We have DC, Florida, New York City, Philadelphia, Erie, Pennsylvania. Oh, New Mexico. Wow. You might be the farthest so far. Lots of Philadelphia, New Jersey, Boston, Austin, Texas. Ooh, I hope the weather's better there. Vermont. Great. Welcome, everyone. Thank you so much for joining for this joint Schools of Nursing graduate admissions webinar. My name is Jamie Bergstein-Eidlin. I'm the Associate Director of Graduate Admissions at Penn Nursing. I'm also joined by my colleagues Jackie Hain at Jefferson University and Cheryl Wirt at Villanova University Schools of Nursing. Today we are going to go over our individual schools. We will be focusing on our graduate program offerings, and then we will go into a Q&A portion. So a few housekeeping tips. We ask that you stay muted during the entire time. We understand that life doesn't stop for these webinars, so you might have family or pets running around, so we ask that you just stay muted. Please save questions for the Q&A. We will get to questions at the end. And a recording of this presentation will be emailed to you in a few days. So if you do have to leave at any point or want to revisit what we've talked about, you can always go back and listen to the recording. So with that said, I will first talk about Penn Nursing at University of Pennsylvania. First, I'm going to very briefly discuss our accelerated options. Again, this presentation will focus on our graduate programs, but I do know there are some people here interested in accelerated options. So all of our accelerated programs at the end will grant you with a BSN, a Bachelor of Science in Nursing. These programs are designed for people who do not have a Bachelor of Science in Nursing, who are not a nurse and want to become a nurse. So first, there's just the straight up accelerated BSN second degree program. It's an 18-month program, and at the end, you earn your Bachelor of Science in Nursing and you become a registered nurse. Next, we have our accelerated BSN MSN program, which is designed for people who are interested in obtaining their BSN, and they may be interested in a graduate specialty and becoming an advanced practice nurse practitioner. So you would obtain your BSN after 18 months. You may go on to work as an RN, and then you would come back for your MSN degree. And that's anywhere between 2 and 5 years, depending on the length of your MSN program and if you work in between. And then lastly, we have our Hillman Scholars BSN PhD program, which is your 18-month BSN program, and then you go directly into a PhD in nursing, and that is for people who are interested in becoming a nurse and also going into a career in research as a nurse scientist, and that's about 6 years, 18 months plus the length of the PhD program. On the left, you'll see the required prerequisites for the accelerated BSN program. These must be completed by May 31st of the year you plan to enroll. So if you plan to apply for 2022 enrollment, these prerequisites must be completed by May 31st. On the right is our application requirements. We do have a pretty standard online application with a resume, a personal statement, We do require that you upload a video interview, and the application deadline is October 15th of every year. Again, that's really as detailed as I'm going to get into our accelerated BSN options. Please feel free to reach out to us in the admissions office if you do have specific questions about those requirements or those programs. Now I'll dive into our graduate programs. Our nurse practitioner programs are offered at the MSN level. Ours focus on population and acuity level. If you are not quite sure yet what area you're interested in, it's important to understand that the population and acuity level is what you'll be practicing in. So if you are interested in pediatric primary care, you will only be seeing pediatric patients in the primary care acuity level. This, for the most part, doesn't restrict where you can work. Of course, you're not going to be in an ICU, but the focus is on population and acuity level, so primary care versus acute care. Our nurse practitioner programs range in population, neonatal, all the way up through adult gerontology, primary care, and acute care. Our nurse midwifery program is a dual certification. So at the end, you'll be eligible to sit for the Women's Health and Midwifery National Certification exams. And then we also have two non-clinical programs, our administration programs, which focus, as the name implies, in administration, healthcare leadership, management, and advancing throughout the administration side of nursing. This is a very basic outline of what our clinical MSN programs look like. Our students start with the 3 Ps, advanced pathophysiology, pharmacology, and physical assessment. They all take theory courses in your population area. Every student is required to take a research class, and at the end, you do have enough to publish, and we guide students throughout the publication process. A lot of our students do wind up publishing or presenting at conferences, so you can certainly be involved in research even if you're not in a doctoral program. And then your clinical placements. We organize clinical placements for you, so every admitted student is guaranteed a clinical placement spot. Our clinicals do take place in Pennsylvania, New Jersey, and Delaware. For those of you not in the area, New Jersey and Delaware are very close to Philadelphia. So you may be traveling an hour or an hour and a half for clinicals, but the states themselves are quite close. And this is what our administration MSN curriculum looks like. The health leadership program, the curriculum is a bit more flexible. You can take classes outside of the nursing school, which is great. We have some fantastic courses at the law school and the business school that really lend nicely to the health leadership program, which is a great option. The nursing and healthcare administration program, the curriculum is a little less flexible, a bit more required courses, and there's also an administrative practicum at a healthcare organization of your interest that you do at the end of your program. We have several minors. The minors cannot be done with every program just due to the amount of electives in each program. And they're often easier to do if you are doing an MSN program part-time because you can fit in classes a little easier. Most of these minors are only 3 courses. Some are just to increase your knowledge in a certain area. Others are you can obtain certification at the end of this minor. So the adult oncology minor, the palliative care minor, upon completing these, you can sit for the national exams in those areas. And the programs with an asterisk after them, they can also be completed as a standalone postgraduate certificate. So perhaps you'd like to be certified in adult oncology or palliative care, but you don't do it while in our program, or you decide to go to Jefferson or Villanova or elsewhere. Once you're completed with that program, you can come back and do one of those minors here. Our MSN programs can be completed on a full-time or part-time basis. About 2/3 of our students are doing a program part-time, so it is a very popular option. The part-time programs take about 2 to 3 years, and students typically work either full-time or part-time during that. Full-time depends on the program. Our longest programs are the Family NP, FNP, and the midwifery program at about 1.5 years each. Others full-time are between 12 and 14 months. Part-time, you can start any semester, spring, summer, or fall. Full-time, it does depend on the program you are applying to, where you're either starting in the summer or the fall, depending on the program. Our acute care programs require at least 1 year of work experience in that population area and acuity level. Our neonatal program requires at least 2 years of work experience in the NICU, and all work experience should be calculated after orientation or any probationary period. Keep that in mind because sometimes orientation can be around like 12 to 16 weeks for some hospitals. Primary care programs do not require work experience, but we always recommend it. We find it makes you a more competitive applicant, and competitive applicants typically have at least 1 year of work experience for our primary care programs. Across the board for all MSN programs, our students have around 3.5 years of work experience when they are entering the MSN program. Next, I will go into our DNP programs. First up is our DNP in nurse anesthesia. This is only offered on a full-time basis. It is 3 years long. It's a very intensive full-time program. You only need to enter with your BSN. You may have seen at one point the anesthesia program was at the master's level. I believe it is by 2025, all anesthesia programs need to be at the DNP level, and ours is already there. So you only need a BSN to enter. We admit about 1.5 to 2 years in advance. So this application cycle applied for summer 2022. When our application opens in July, our applicants will be applying for summer 2023. So if you are interested in that program, again, keep that in mind that you're applying about 2 years in advance. There is a strict work experience requirement. You do need at least 2 years working in the ICU or critical care units, the most critically ill patients. And our competitive applicants typically have around 4 years of work experience. The curriculum is fully integrated. A lot of programs will do, your first year or so is classroom, and then the end is clinicals, not us. The program starts in May, and in August, you are already in your clinicals. We operate on a primary site model, which means you are assigned a primary clinical. So you go to that clinical first, and throughout your 3 years, you're rotating throughout your specialty rotations and your other rotations, and you always return at the end of these clinical placements to your primary site, which is a great way to integrate what you've learned in your specialty rotations. And a lot of students wind up getting hired at their primary site because they had such a great experience. Again, clinicals are in Pennsylvania, New Jersey, and Delaware. We also have 2 clinicals for the anesthesia program in Maryland at Baltimore Shock Trauma and Johns Hopkins. And for those, we do have a student apartment since that is a little farther than our other clinicals. We have 2 postmaster's DNP programs, which means you do need a master's degree in order to apply to these. We first have the postmaster's DNP program, which is designed to expand the skills of master's prepared nurses. Again, for this program, most applicants are coming in with work experience. However, you do just need an MSN or a master's degree in nursing, such as administration, education. Some who have a master's degree in anesthesia would also be eligible for this program. And then we have the executive leadership DNP, which is designed for masters for pair nurses who do have a bit more leadership and fiscal management experience, and who may have some executive level skills already. And this program requires an MSN or a master's degree in a related field, such as an MBA, an MPH, and 2 years of leadership and fiscal management experience. Both of these programs are 2 years, part-time, and classes are 100% online. And when we are able to gather, there will be a few on-campus intensives for each program. And then last but certainly not least, we have our PhD program. And the goals for this program are to develop you as a scholar and a scientist. This PhD program is really designed for research and for graduates to go into a career in nursing research. Our full-time students are fully funded for the first 4 years, which includes a stipend and covers tuition fees and health insurance. And most students do finish within 4 years. The curriculum is pretty standard for your PhD curriculum. There are 2 ways to be funded. One is through school funding, which would include a teaching residency, so you would be a TA, or you might be funded through one of our research centers if your research interest is related to one of the research centers, and you would be funded through a research residency where you would be doing secondary research for that center. These are the application requirements. I can get into a little more detail if anyone has specific questions about these. And in general, what we look for, we have a holistic application process, which means we are looking at all parts of the application. Of course, we have minimum requirements for certain parts of the application, but we are not just focusing on your essays or academics or recommendations. We are looking at the entire picture. We're looking for a demonstrated interest in the population area you're applying to. For our DNP and PhD programs, we're looking for a demonstrated interest in your project or dissertation topic, and you don't need to have that completely flushed out, but we do want to see that you've thoughtfully discussed the research topic and that you do have a demonstrated interest, whether that be personal, professional, or other. For the PhD program, faculty fit is super important, so we want to see that you've made connections with faculty. And your passions, your goals, your reasons for applying to this program, and why Penn Nursing. You've got great schools right down the road, Jefferson, Villanova, other schools around the country. What is it about Penn Nursing that you are interested in? And if you are not tired of hearing me talk, we have 2 other sessions coming up where we go into more detail in the programs. You'll also have a chance to meet faculty. This Wednesday, we have a faculty panel, and Friday, March 5th, we have a virtual open house. Again, you'll have more of a small group chance to meet faculty and learn a little bit more about our programs. And lastly, our application deadlines. We are still accepting applications for part-time summer or fall enrollment for our MSN programs. You need to apply by March 15th. If you're interested in enrolling for 2022, or for the nursing anesthesia program 2023. Our application will open in early July, and these are the tentative deadlines. They're usually around the same time every year, but things might change, so don't write these in stone just yet. And that is all I have. I know I talked very fast, but we have 2 other schools to get to, and of course your questions, so happy to answer any questions at the end. And I believe, Jackie, you are up next.
Thanks, Jamie. I'll share my screen here. And while that's loading, I'd also just like to thank Jamie and Cheryl for their partnership tonight in putting this event together. I'm so pleased to get to talk to you about all of our graduate nursing programs at Jefferson. Oops, let me just change my display settings. There we go. So we'll start out tonight talking about our available programs, some highlights of them. I'll cover some admission information. I'll also give you some cost and financial aid information and provide some resources at the end. So very similar information that Jamie shared as well. I'll start with the accelerated BSN program. Just as Jamie mentioned at Penn, this program is available for someone who is not a nurse, but looking to pursue a BSN as entry into practice as a nurse with a prior bachelor's degree in a non-nursing field. Great thing about our accelerated BSN program is that it does give you a head start on your graduate program. So in addition to the accelerated BSN, our BSN curriculum includes 9 graduate credits and admission into our MSN or DNP program options for all of our nurse practitioner programs. It does not include nurse anesthesia, of course, but admission into any of the other nurse practitioner programs is valid for up to 2 years. So many of our BSN students will graduate and start working first while they further decide which NP program to pursue. And then as long as they come back to us within that 2-year window, their admission is valid, assuming they've met all the progression criteria, have their RN license, everything required to proceed into the graduate program. The program is called the FACT program, full-time accelerated coursework track. You don't need to remember that though. And it's available in 2 different formats. So we offer the 1-year and the 2-year option. The FACT 1-year program is going to be very accelerated. So that is for someone who can not be working, who is able to commit very full-time to the program. It's done in 12 months. I think it's the fastest out of all the schools here tonight. That program starts in May each year. If you're thinking 12 months is a little too quick for you, we also offer the 2-year option, which is, it's not quite 2 full years, it's just 2 academic school years. So starting in the fall, and students take coursework in a full-time format over 2 semesters each year, fall and spring, with traditional breaks built in. So some of our students are able to work a little bit part-time while in this program, although it is still a full-time course load. Students who are interested in pursuing after their BSN entry into the midwifery profession as a nurse midwife may also choose the FACT plus midwifery option when applying. So instead of moving into our nurse practitioner program after completing their BSN, they can move into our midwifery program. The rest of my presentation tonight won't focus too much on midwifery. We do offer it as a master's degree program at Jefferson that is available through our College of Health Professions, not the College of Nursing, but we do certainly offer it at Jefferson. If you have a BSN degree, you can absolutely apply to that program. And our accelerated BSN programs are completed full-time in person, and those are available at either our Center City campus in Philadelphia or our Dixon campus, which is in Horsham. That's a suburb to the north of Philadelphia. So now getting into our graduate programs, we offer, there we go, the Master of Science in Nursing, MSN program, as well as a Doctor of Nursing Practice program for nurses prepared with their BSN degree. These programs are available in 6 nurse practitioner concentrations listed here on the right. So adult gero acute care, adult gero primary care, family, pediatric primary care, neonatal, and women's health are our current NP options. Right now, we do not offer any non-clinical or non-NP tracks. So all of the concentrations within our MSN or DNP options will be NP programs. We'll get into some details on the next slide of the MSN program. And then we also offer the nurse anesthesia program that is included at the DNP level as well. And we'll get into some details on the next slide for that too. So some highlights of our MSN program. The program itself is 12 courses, 36 total credits. We only offer a part-time option at Jefferson. So that is one distinction between the schools here tonight so far, is that our program, we are not currently offering a full-time format. The vast majority of our students are working while they complete this program. So it is very much meant to be accommodated. Faculty understand that the program is not the only thing happening in your life. Most of our students are working or have other responsibilities that faculty are well aware of. It takes most of our students about 2 to 3 years to complete, depending upon their plan of study, taking a combination typically of 1 to 2 courses per semester. There are 3 semesters per year, fall, spring, and summer, and students can enroll in any of those 3 start terms. Most of the coursework is completed online. We call it a hybrid program though, because there are a few on-campus intensives, particularly during the clinical courses. Each clinical course, there are 3 of them total. Each clinical course includes 2 to 4 on-campus intensives, which are an opportunity to be on campus with your classmates for team-based learning and interactive interprofessional opportunities. Each clinical course also includes 224 hours for a total of 672 clinical hours. Clinical placement at Jefferson is seen as a partnership and joint responsibility between the students and the faculty. So students are strongly encouraged to identify their own clinical placement site that will help make placement as geographically convenient in many ways as possible for students, but faculty are also able to assist in placing if needed. At the DNP level, so this is the post-BSN entry into the DNP, students will complete 11 MSN level courses. So we actually take one of the MSN courses in the MSN program and offer it at the DNP level. So it does save you some time and money in number of courses to complete, and then complete 12 DNP level courses. One of the nicest things about this program is once a student completes their MSN coursework, they are able to sit for their NP licensure. So they can be practicing while they complete the DNP. This program is also classified as a hybrid with most courses completed online, a handful again of those on-campus intensives while in the MSN coursework. All of the DNP level courses are taught online. And this program would take you approximately 4 to 6 years to complete. Again, that might sound like a long time, but keeping in mind that you are completing a terminal level degree and probably doing it while you're working. So again, this is meant to be approximately 2 courses per semester. You can take more than that if that's what you'd like to do, and your plan of study can be accommodated for that. But generally, most of our students are working while taking their courses part-time. The nurse anesthesia program is different than the rest of our programs. Of course, this is a very full-time commitment. This program is offered as a fall start term. It takes 3 years to complete over 3 semesters each year, fall, spring, and summer. Clinicals will begin in the 3rd semester. So students begin the program in September, and by the following May, the start of their spring semester, or excuse me, the start of their summer semester, they'll be starting in clinicals, which is then integrated. So each semester has clinical and didactic coursework. We do also use a primary site model, as Jamie mentioned, at Penn. So we have 22 primary sites at Jefferson located throughout Pennsylvania, New Jersey, and Delaware. Students are able to participate in a lottery system, if you will. The vast majority of our cohort each year gets one of their top 3 choices for their primary site. And students do sometimes rotate out of their primary site for those specialty settings. It really depends on what is available at each of the primary sites. Students also complete a doctoral inquiry project, and that is done over 3 semesters within the program. Moving on to our program options for the MSN prepared nurses, we offer a number of postgraduate certificate programs. I'll be covering these in a little bit more detail on the next slide. We also offer a post-MSN entry into the DNP. This program is completely online, and it's 12 courses, 36 total credits. Generally takes about 2 to 4 years to complete, again, usually in a part-time format, because our nurses are working while they do these programs, and available as fall, spring, or summer start terms, just as our MSN programs are offered. We've already touched on the Doctor of Nursing Practice program for nurse anesthesia. The nurse anesthesia program can be entered as someone with either a BSN or an MSN degree. It doesn't change the curriculum though of the program. If someone does enter it having already had their MSN degree, we just offer one program regardless of what entry point someone is coming in. But you can apply with either a BSN or MSN. Some additional highlights about our postgraduate certificate programs. So I'll start with the nurse practitioner options. The nurse practitioner options are available in those same 6 nurse practitioner concentrations we already went over earlier. The program itself includes 6 courses, the 3 Ps, pathophysiology, pharmacology, and physical assessment, followed by the 3 clinical courses. So 18 total credits for this program. Generally takes students about 1 to 2 years to complete. Again, part-time is the only option. There is no full-time option for this kind of program. Clinicals are completed in 1 semester at a time. So typically over the summer, fall, and spring semesters in that order. And each clinical course, again, has anywhere from 2 to 4 on-campus intensives in addition to the course and the clinical hours. Moving on to our academic nursing postgraduate certificate. This program is brand new for us at Jefferson. We're offering it for the first time this year in 2021. This program will take 1 year to complete. It has 3 courses taken in the summer, fall, and spring semesters. So again, a part-time format meant for a working person to be able to complete. The academic nursing postgraduate certificate is for someone who is perhaps a nurse practitioner, although does not have to be, and may want to get involved in academia. And lastly, the advanced headache diagnosis and management program is pretty exciting and different. This is the only program offered by the College of Nursing at Jefferson that is able to take an interdisciplinary cohort. So we welcome anyone who is a healthcare provider treating headache patients. That can be nurse practitioners, physician assistants, physicians, dentists, any type of provider who is working with headache patients and wants to advance their practice and learn more. And that program is also 1 year to complete, as 3 courses taken over the fall, spring, and summer semesters. So next, I'll talk a little bit about how to be prepared to apply to our programs. My slides tend to focus on some of the minimum requirements needed to apply. There's a lot more specific information about the application process on our website, but we're already giving you a lot of information tonight. So I'll let everyone check out the website on their own. So in terms of preparing to apply for any of our nurse practitioner programs, that would be any of the MSN postgrad certificate or BSN to DNP program options. We have 3 start terms per year, as I've mentioned, fall, spring, and summer. We do review completed applications on a rolling basis. So while the application is open, we are reading applications and rendering decisions. So you don't need to wait until the deadline to apply, although these final deadlines are in place. June 1st is our next upcoming deadline for the fall semester. The spring application deadline is October 15th, and the summer application deadline is February 15th. So that did just pass for this summer's entering class. There are 3 prerequisites we're looking for any of these programs: statistics, physical or health assessment, and research from your BSN. Generally, most students have all of these courses taken if they've earned a BSN. If there are any specific questions about prerequisites, we are also, of course, happy to assist you before you apply to make sure you're in good shape and ready to submit your application. In terms of work experience, we do have work experience requirements for our acute programs as well. So the adult gerontology acute care program requires at least 1 year of experience working as an RN. This does not need to be in any particular setting or unit, just 1 full year at least of work experience. The neonatal program is a little bit more specific. This one does require at least level 3 or higher NICU experience for at least 1 year at point of application. For the academic nursing postgraduate certificate, this program I mentioned is a summer start term. The application deadline for this year is April 1st, so there still is ample time to apply for this program for this summer. We're looking for at least a 3.5 in your graduate nursing degree. And those same 3 prerequisites you'll see on all of these slides for all of our programs: statistics, assessment, and research. The advanced headache diagnosis and management postgrad certificate I've mentioned is a fall start. We are accepting applications for this program until a final application deadline of August 1st, but we do encourage you to apply early. Space is limited in this interdisciplinary cohort. Again, to apply, someone just needs to be clinically practicing as a nurse practitioner, a physician assistant, a DO, an MD, dentist as well, and have at least a 3.0 in their graduate program. our post-MSN entry into the DNP, same application deadlines as I mentioned earlier for those fall, spring, and summer start terms. So fall is the next available start term to apply for. And I should mention that these are, we do accept applications for the current year. So the applications that we are accepting right now are for fall of 2021. So you're applying for the upcoming, next immediate start term for these programs. Our minimum GPA for the post-MSN into DNP is a 3.2 in your MSN. And again, those same statistics, assessment, and research to be prepared for the program. And the last program I'll mention in terms of the admissions process is our anesthesia program. This program, the admissions process runs a little bit differently due to the competitive nature of the program. We strongly recommend applying as early as possible because interviews will begin, and once interviews are ongoing, we will only continue them until the cohort and the wait lists are full. So we recommend applying as early as possible. We do open the application 1 year in advance. So the application that will open this year, August 1st, is for the cohort joining us in fall of 2022. So a little bit different than what Jamie had mentioned for Penn. It's only 1 year in advance. So again, we recommend applying early. I would highly recommend applying by at least the November 15th priority deadline to ensure that your application can be considered. Typically by the final deadline of February 15th, we are only considering candidates for the wait list. The GPA minimums are listed here, 3.2 BSN GPA, and we do also calculate a science GPA, which is cumulative of all of your lab science courses taken, and that should be at least a 3.0. The same prerequisites are in place that I've mentioned a few times already. And the work experience to apply to this program would be at least 1 year of critical care experience. The critical care experience can be obtained in any ICU setting. There's not one particular ICU that's better than any others. There's also a good list on our website of all of the different types of skills and experience that you should be obtaining in your ICU setting to be prepared to apply for this program. I'll also mention, to echo what Jamie said, that at Jefferson, we review applications in a very holistic format as well. I've listed here some very concrete information for you because this is what I'm most frequently asked about in terms of being prepared to apply. However, each application is reviewed very thoroughly. We look at some of the quantitative information, but all of the other information in your application, letters of recommendation, your personal statement are equally as important to faculty when they're reviewing. The nurse anesthesia program is the only program that we require interviews for, that we have an interview process. The remainder of our programs generally do not interview applicants, and they are using a personal statement to render decisions along with all the other information. So there's one thing I can recommend to everyone tonight is to make sure when you're applying to whatever school and whatever program that your personal statement really articulates, why you're pursuing the particular program you're pursuing, because that is an integral part of every application. Last thing I'll cover are just some additional resources that may be of interest to you. So the first one is some financial aid information. Currently, our tuition is charged per credit, $1,200 per credit for all programs except nurse anesthesia. And this also is exclusive of the accelerated BSN that has some separate tuition as well that you can see on our website. So nurse anesthesia does have an annual tuition rate, but all the other programs are charged per credit. You can also apply for financial aid by submitting a FAFSA if you'd like to do that. Only our degree seeking programs, MSN and DNP programs, are eligible for financial aid. The postgraduate certificates are not currently. And then one last thing I'll mention is I know many of you are probably working and maybe looking to stay working while you complete your graduate degree. So don't forget to check with your HR office for any potential tuition benefits. Many of our students, that's the primary reason why they're staying working while they do their program, is to have some help paying for their degree. If you'd like to get some more resources after tonight, know that we're giving you a lot of information in a short period of time. So you can definitely feel free to go to our website and watch an on-demand program information session about all the programs that we talked about this evening. The on-demand sessions, you can watch them whenever you want and repeat them as many times as you'd like. And we also have virtual campus tours that you can view. And then a great opportunity we've had all year long is our masterclass series. This is where our faculty, our experts, are presenting basically a free masterclass to anyone who'd like to sign up about research, current events within their field, within the profession. So we've had some really engaging topics from our wonderful expert faculty. The next series of those is happening in April. And you can see all of those upcoming topics and dates at jefferson.edu/virtual visits. And this is the link, my.jefferson.edu/apply if anyone is ready to apply to any of our programs. And lastly, I'll leave you with some contact information for the admissions office. You can reach us at enroll@jefferson.edu, or my direct phone and email are here as well. So with that, I will thank you for your time, and I will stop sharing my screen and turn things over to Cheryl.
Thanks, Jackie. Hi, everyone. Let me pull this up. There we go. Okay, perfect. So as Jamie had said in the beginning, I'm Cheryl Wirt. I'm the recruitment specialist and coordinator of transfer students for Villanova Nursing. And thank you all for joining us. I know it's tough on a Monday night, but happy to have everyone here. So I will go through pretty much the same thing everyone else has gone through as well. Okay, so Villanova Nursing, we are named a Center of Excellence in Nursing Education by the National League for Nursing, and we are ranked among the top graduate nursing programs in the nation by U.S. News and World Report. Why Villanova Nursing? So we have excellent programs and learning environments, dedicated, helpful faculty and staff, strong interest in student success, varied support systems available, outstanding facilities, and state-of-the-art simulation and lab resources for positive learning experiences. Program offerings as a whole, and this will be very similar to what Jackie and Jamie went through as well. On the undergraduate side, we have traditional four-year BSN offerings for high school seniors coming in for the four-year BSN. And then we have our second degree accelerated BSN, more commonly known internally as the BSN Express. And then on the graduate side, we have MSN, postmaster's certificates, postmaster's DNP, nurse anesthesia DNP, and PhD. And all of this information can be found at villanova.edu/nursing as well, if you have any questions after this ends tonight. So to start, we'll start with master's level program tracks. So we have adult gero nurse practitioner, 47 MSN credits, and 32 postmaster's credits. Then we have the PNP, 45 MSN credits, 27 postmaster's credits, FNP, 47 and 32 as well. And then we have nursing education, 46 MSN, and then 9 to 15 postmaster's credits. Just to note, the NP level is primary care. We do not have acute care at this time, so it's primary care for all of those. Regarding nurse practitioner courses at this time, they're provided in both a hybrid and an online format right now. Most courses can be taken online. However, the physical assessment course and classroom course during clinical experience is presently on campus. And we'll figure out how things go based on COVID and as things progress. But for right now, that's how things are taking place. Our doctoral level program options. Nurse anesthesia DNP is 73 credits. Postmaster's DNP is at 32 credits, and the PhD is currently at 46 credits. And I'll go into some more detail with those as well. So for the nurse anesthesia, 3-year full-time program with the ability to take DNP courses prior to the January cohort start. Requires 1 full year of ICU experience. And the next slide will go into more detail on that. Postmaster's DNP, as I said, 32 credits. We have 3 options with this, which is pretty new. The flex option is new within the last year or year and a half. So we have a full-time option, part-time, and a flex time option. So the full-time would be 5 semesters, the part-time is 8 semesters, and the flex option would be 11 consecutive semesters, respectively. Online and on-campus sessions, rolling admission for this, and cohorts begin each June. Postmaster's DNP for APRNs and nurse administrators as well. PhD, 46 credits, full-time or part-time, and then there's online plus summer residency, first 3 years. Obviously, this would be for teacher scholars, and generally PhDs are completed within 5 to 7 years. So the nurse anesthesia DNP, we have a joint program with Crozier-Chester Medical Center. Sound base of theoretical knowledge and clinical experience. Must hold a BSN. If you possess an MSN, you can then enroll in the post-baccalaureate nurse anesthesia DNP track. 3.4 GPA for admission. 24 spots are available annually. It's very competitive, as are the others. 1,600 to 2,000 hours of clinical experience will be garnered, and you will work on 600 plus cases in the course of your time with us in those 3 years. It's a 2-to-1 student to faculty ratio in that program. Postmaster's DNP, designed for APRNs, nurse managers, and nurse administrators, evidence-based practice that provides organizational leadership and financial acumen. The DNP Scholarly Project is done where at your place of work. DNP advisors assist with that. You enter with 500 clinical hours from your NP experience. 3.5 GPA or higher in your MSN program for admission consideration. And as I said, the full-time, part-time, or flex time. And it's an online program for the most part, though cohorts come to campus for set days that are communicated well in advance. So generally it would be for 4 days. Typically it's a Monday through Thursday where you would be on campus in your cohort, definitely the beginning when you start in June, I believe again in September, and then again in January. But again, that's all communicated and laid out for you, especially depending on the track that you select. And those tracks are detailed on the website as well, so you can get an idea of what you're looking at as far as time commitment. And then there are scholarship opportunities with the Postmaster's DNP. 2 that we have right now are the Ashley Rose P-Tech Nurse Scholars Fellowship. And this is regard to, there's a full-time and a part-time tuition that would be covered for this for those working on critical aspects of spina bifida care. So that's one option. And then the other one that we have is the Dr. Abigail Adams Silver Endowed Nursing Scholarship. And that provides financial support to a student with demonstrated financial need working in the field. His or her project is in the field of oncology. So we can certainly talk to those or explain more about those if you have questions. Next up would be our PhD. Seeks to educate graduates who will be well prepared to conduct clinically based and or education-based studies to advance nursing science. Teacher scholar model of the program focuses on graduates who will be equipped to teach diverse populations of students in a variety of educational and clinical settings. Prepares applicants to be active contributors to the advancement and development of research and to be participants in various roles of faculty within academic institutions. Curriculum is a fall and spring semester distance learning approach, and then there are on-campus summer sessions. Fall and spring classes are scheduled between 4 p.m. and 9:30 p.m. on 2 weeknights, Monday through Friday. And as far as application deadlines for MSN and Postmaster's certificate programs, fall semester, we have an early decision of April 1. We have a regular decision of July 1, and then spring semester regular decision is November 1. The DNP deadline is March 1st annually. PhD deadline December 1st annually. And then the anesthesia program, anesthesia DNP, the portal opens April 1st and it remains open through September 30th. And as I said before, there are 24 spots for that, so it's pretty competitive. Touch lightly on this, second degree accelerated BSN for any of you who are listening who may have family members or know someone who's looking for BSN having earned a bachelor's in another field. 14 months beginning each May, and it runs through the following July. Breaks are given every 5 to 7 weeks. So typically you will have a summer break, a fall break, a winter break, and then a short spring break as well. Prerequisites must be completed beforehand. Pathophysiology is one of those prereqs, and we offer here at Villanova online each spring. Many students take advantage of that, just taking it when they're finishing up senior year, wherever they are, or if they have already earned a bachelor's degree, they will take it that spring semester just before joining us. We have 2 deadlines. We have an early action deadline of June 30th, and then we have a final deadline of October 1 for admission the following May. And typically admission acceptance letters are sent out between December and January for those final ones that come through in October. It's a rolling admission process. Admission requirements, GPA of a 3.0 or above, and a C or above in all prerequisites, especially the science courses. And then here's a list of the accelerated BSN prereqs. I know some people are interested in knowing what they are. Of course, these are on our website as well, but they're the typical A&P 1 and 2, chemistry, micro, patho. And then we do have English Lit, and we have 9 credits of humanities that are required. And then Villanova also has 3 credits of theology or religion that is required as well. But we can always answer any questions. And they do a pretty solid review of transcripts from other institutions, especially where that first bachelor's was earned. So we have open houses coming up in March. Generally, we would be having these open houses. There would be one evening of open house for the graduate program, one evening in March. And again, we do that again. We do it in October as well annually. However, due to COVID, obviously all of this will be virtual. So we've broken them up over 3 different nights. So the PhD open house is Tuesday, March 9th, 6:30 p.m. The DNP is Wednesday, March 10th, 7 p.m. And then MSN and nurse anesthesia DNP Thursday, March 11th at 7 p.m. And obviously I have the website there where you can register. And of course you can just go to villanova.edu/nursing and find the open house information there as well. Whether online or on campus, your degree from Villanova Nursing comes with a personalized touch, customized plan, faculty mentors, and targeted curriculum delivering exactly what you need to succeed and lead in healthcare today. And here's some photos. And then as a thank you, everyone who attends this evening will receive an application fee waiver code via email within the next week for future use, should you decide to apply to any of Villanova Nursing's programs. Jamie will be putting that together for us. So once we get those, we will share that with everyone. That's it. Thank you.
Okay, so now we'll go into Q&A. I know everyone is probably overwhelmed since you just got 3 different school presentations in a short amount of time, and we have all been staring at screens for the past year. So again, you'll get our as a recording. Afterwards, you'll get our contact information, so don't feel you have to ask questions right now. But if you do, just type them in the chat box. If they're for someone specific, just indicate that, or general, and we can take turns answering them.
It looks like the first question is for Jamie about the application deadline to the NP full-time program.
Okay. So the full-time deadline for our MSN programs is in November of every year. So that has passed for 2021. If you're interested in 2022 enrollment, the application deadline will be November 2021. And I see there's a question about the health leadership program with a minor in global health. Do you have examples of what some of the alumni from this program have gone on to do in their careers post-grad, particularly in the global health field? That's a great question. Off the top of my head for global health, I don't have an answer, but if you want to email me, I can connect you with the faculty. A lot of our alumni do go on to advanced administration roles, such as nurse managers and unit managers, things like that. So you could absolutely take that abroad, hopefully soon. And oops, sorry about that. And then I'm not sure if I mentioned this, but our MSN programs are on campus. on our Philadelphia campus. The only programs online are Postmasters DNP and Executive Leadership DNP programs. And then I see there's another question. I have AP credit on my college transcript from AP statistics. Does this count towards the statistics prerequisite? For Penn, that would count. You wouldn't need to retake statistics.
For Jefferson, that would also count. Yes. Cheryl, you're on mute.
Yes, for Villanova, it will as well, as long as you earned a 4 or a 5 on that statistics exam.
And I just see another Penn one, and then it looks like the next ones are for Jefferson and Villanova. For the direct entry program, can you apply while only having some of the prereqs done so far? Yes, you can. If you are coming from a non-science or non-healthcare background, we recommend having at least half completed already. If you have a degree in English or humanities, it would be a good idea to have some science in your background. If you're coming from a science program, you don't need as many completed when you're applying.
I see the question regarding part-time postmasters DNP. So for Villanova, that would be the part-time is 2 years. The flex time one would be 3 years. So the part-time is 8 semesters, the first one, and then the other one is 11 semesters, so 3 years in theory. But if you're asking for the specific, the full-time, part-time, and flex time, the part-time would be 8 semesters, so 2 years.
And for Jefferson, for the postmasters DNP, students create a plan of study before entering the program. Generally, it takes them anywhere from 2 to 4 years. 2 years would be taking about 2 classes per semester. 4 years would be the slowest possible route to take, which is 1 class at a time. Most people do try to get done a little bit faster than that. So generally we say, 2 to 3 years if you're taking 1 to 2 courses at a time. It looks like the next question is for Penn and Jefferson about passing rates for the acute care nurse practitioner programs. I am actually not sure about acute care specifically. I know our pass rates overall are very high, but I'll have to find out the answer for acute care in particular. So if you do want to email me, Jamie, can we also maybe put up the slide right now with our email addresses on it so everyone can grab that if they need any follow-up?
Yes, let me do that and attempt to answer at the same time.
Sorry, I gave you 2 tasks.
So our pass rates are typically above 90%. Again, if you want to send an email with which program you're interested in, either adult or pediatric acute care, I can get you that specific pass rate. And everyone should be able to see my screen now with our contact information, and it'll also be in the email that you get with the recording in a few days.
Thanks, Jamie. It looks like the next question is for you about the Penn MSN. Is the non-clinical coursework online or in person?
No, so again, I'm sorry, I don't think that was in my presentation. All of our MSN programs are on campus. Because of the pandemic, classes have been online, but when things return to normal, whenever and whatever that might look like, we do expect that they will be in person.
The next question is about PhD programs specifically. What are the educational requirements? So I'll step out of this one because we do not offer a PhD at Jefferson, just a DNP.
For Penn, you can enter with a BSN.
Yes, and Villanova as well.
The next question looks like it's for me. What exactly is the BSN research prerequisite? So most BSN programs include a course called research or nursing research, or sometimes evidence-based practice. EBP is often the name of the course instead of research, but this would be the course where you learned about nursing research. So usually it's pretty straightforward, but if you're not sure based on your transcripts, usually almost every applicant has had a research course in their BSN, but if that's not the case for you, or you had a different named class and you just want to double check, please email me. You can send me the school and the course name and course number, and I can check to see if it would be the appropriate prerequisite. Okay.
I see Jessica is asking about our postmaster certificate in adult gero acute care. Yes, if you're interested in our Streamline program, send me an email or email admissions. So this program, if you're a primary care prepared nurse practitioner who has been working in acute care, we offer a 3-course postmasters in adult gero acute care. So just send me an email and I can send you a specific webinar about this program.
Next question seems to be for Penn and Jefferson. What is the average class size? I think we might need to drill down a little more specifically for which program potentially this question is addressing. So if the person who asked that question wants to rephrase it with a particular program, I will mention that across a number of our programs at Jefferson, the core courses are applicable to many programs. So you would be taking those classes and some of the 3 Ps as well, Patho-Pharm and Physical Assessment, with students in other NP programs. They're not really cohorted programs. Students can be taking courses with other students in other programs. So I will mention that. But if you want to chat back another question about a particular program, we might be able to give you more specific information, unless Jamie wants to answer that for Penn.
Ours is pretty similar. Our core courses are shared amongst the NP programs. They could be around 100 people or so. And our family program shares classes with pediatrics and adult, and our women's health and midwifery program shares classes as well. Those theory courses wind up being between like 15 and 30 people, depending on the course.
It looks like the next question is for me at Jefferson. This person's asking nursing courses being pass-fail, but your website says pass-fail classes are not accepted. Is this still the case with COVID? Well, if you're referring to any prerequisites, we only have 3 prerequisites. And if a prerequisite course was taken during the pandemic and your school only offered a pass-fail option, that absolutely can be considered. Yes, we would not hold that against someone because they took a course pass-fail and it was during the pandemic, where every school, well, maybe not every school, but I know many schools offered that option. So yes, that is absolutely acceptable. So hopefully that answers that question. I think the next question looks to be about for Penn. Jamie, this question from Emma. She says, as far as I know, the full-time for UPenn MSN did not open for fall 21 due to clinical site availability. Is the part-time for fall 21 open?
The full-time application was open. I read all of the applications for them. So I do apologize if you received conflicting information. We are still accepting part-time applications for our MSN programs for summer and fall. That deadline is March 15th.
It looks like our next question is for all 3 schools. Is it possible to apply for 2 different programs, perhaps a DNP and nurse anesthesia program at the same time? So I'll take this one first. At Jefferson, we do encourage you to apply to 1 program at a time. You can only be, you're only 1 person, so you can only be offered 1 seat in 1 program at a time. So we would recommend that you choose whichever program you are most strongly interested in. If you are not offered admission to that program, we can absolutely talk about other options. So that's an individual counseling we could have, but we do ask that you limit your application to 1 program per start term.
That would be the same for Villanova as well, to choose the program of most interest to you and then apply that way, especially because the timelines are different and deadlines are different for each of our programs.
Yep, and same for Penn. I see Andrea's question for the Penn NP program, how many classes are usually offered for the term? I hope I'm answering this correctly. If you're full-time, you're taking typically 4 classes a semester. If you're part-time, that depends on your, that depends on your plan of study. Most part-time students are taking 1 to 2 courses a semester.
The next one, I'm retaking a course to get a better grade before applying to CRNA school. Would my old grade still bring my overall GPA down? I believe in the case for Villanova, they would want to see that increased grade. So when you apply or when you're in touch with us, you would indicate that so that they can take that into account. If it definitely pulled down your GPA, we would want to know that you had earned a higher grade in the retake. So that would be more on a case-by-case basis, how they look at that.
For Jefferson, for our nurse anesthesia program, currently the 2 GPAs we look at are their BSN GPA, which is not necessarily going to change, right? Your BSN has already been completed. So if you are retaking a nursing course, we're not recalculating like a new BSN GPA. So it's a snapshot of what your BSN GPA was when you completed your BSN. We do calculate a cumulative science GPA. So if you are retaking a science course to improve your science GPA, then it is a cumulative GPA. So that includes all attempts. So a new grade can absolutely increase your GPA, but by how much it increases depends upon how many, courses and other grades that you've already had. So hopefully that helps answer the question. But again, we've talked before about reading applications and making decisions based on many factors. GPAs are just one factor of that. We do look at a lot of things about an application. But yes, the grade would count. We would look at both grades if it was the science GPA.
Same for Penn. We won't recalculate your GPA, but again, we will see that you retook the course and hopefully did better. And that would show initiative on our end.
Looks like our next question is about taking biostatistics. And would that count for the stats prerequisite? So for Jefferson, yes, stats can come from any department. It does not need to be like nursing specific. Usually it's not. Stats is offered through other departments. So yes, biostats, psychology stats, stats from any department is okay.
Same for Penn, which is nice. So, if your first degree was in business and then you got a BSN and you didn't have to take stats, we'd take that business statistics course.
Yes, and Villanova would be the same as well. Biostats, regular stats, business stats would apply as well.
So there's a question, how do you determine scholarships? So for Penn, for our full-time MSN applicants, we have merit-based scholarships that you are automatically considered for based on aspects of your application. We also have school-specific scholarships based on the program you're applying to, your interest, if you're a veteran, Peace Corps alumni. We also have a scholarship if you're a Penn Medicine or Children's Hospital of Philadelphia CHOP employee, where you can get basically 4 classes for the price of 3 in a calendar year. If you take 3 courses in one calendar year, the next course that you take in that same year will be free. But for our merit-based scholarships, they're mostly based on your admissions application.
At Jefferson, the College of Nursing is not currently offering any merit scholarships for new students into our graduate programs. Certainly, we encourage anyone in degree programs to apply for financial aid to see what eligibility you may have. But at this point in time, there are no merit-based scholarships. You can also look for external sources of funding. We've touched a little bit on that already tonight, but you can bring with you any other scholarships that you may receive externally as well.
And the same for Villanova. The scholarships we have right now are those 2 that I mentioned with regard to the DNP program. And if any become available, more available, we would certainly let students know, but at this time, we do not have any.
And I also just want to add our merit-based scholarships are limited. I don't want to steer anyone in the wrong direction. And just to echo what Jackie said, external scholarships are a great option. There is a scholarship for almost everything and everyone if you just put in a little time and effort. So that's definitely an option for any program.
The next question looks like it's from James regarding Villanova's nurse anesthetist DNP application year. So James, you will need to go on the website at this point to find out, but I believe at this point in time, we are taking applications for fall 2023. We are really far out. It may even be fall 2024 based on that 24 seat capacity that we have. And I can find that out for you and email you that information more specifically.
Cheryl, it looks like the next question is also yours.
Yes, and back to that with regard to scholarships across the board, those that we have right now are the two for the DNP.
There's a question for funding for PhD students. Is it also for international students? Yes, for Penn, we will fully fund international students.
The next question looks like a clarification for you, Jamie. I don't know if we covered this already, though. How many classes are offered in a term for the NP program? I think we did.
So for the part-time program, you're typically taking 1 or 2 courses if you're enrolled part-time.
Okay. It looks like our next question, correct me if I'm wrong, is about from Nina, who is active duty military, and how would that affect any clinical placement through any of our schools? Well, firstly, thank you for serving, Nina, if you are currently, and that absolutely would not be held against you by any means. The faculty will work around that. I'm not sure the details because I'm not faculty working on clinical placement, but I believe that that is something that can be accommodated. It kind of probably depends on where you are, what the schedule is like. So that's something you'd want to talk to the program director specifically, given whichever program you're interested in. And that is also something, if you'd like to reach out to me directly, I can connect you with the right program director so you can have that information as you're deciding to apply.
Same for Penn.
Yeah, absolutely. Same for Villanova. Happy to connect you with the program director for that. And thank you for your service.
Mm-hmm.
Our next question is for everyone, all 3 schools. Is there an expiration date on any prerequisite courses? So for Jefferson, for any of the prereqs we've mentioned, for our graduate nursing programs, no, there is no time limit on the prereqs. We haven't touched on prerequisites for the accelerated BSN program. If anyone was considering that, there are time limits on those. Those are all outlined, the exact prerequisites and time limits on the website. But for the graduate programs, no time limit.
Same. Thank you, Jackie, for making it easy. For Penn, no limit on grad programs. For the accelerated prerequisites, they do need to be taken within 10 years, and A&P should be taken within the past 5 to 6 years.
That's how Villanova is as well. 5 to 6 years for A&P and microbiology as well. And then no limit for the graduate.
Our next question is from Andrew. It's a question about transfer credit. So it looks like you have 2 graduate level courses taken already in nursing. Would these be considered for credit at any of our schools? So at Jefferson, students, once they're matriculated or as they're matriculating, can have credit, previously taken graduate level credit considered for transfer. At most, we would transfer in up to 2 courses or 6 credits. If the courses are equivalent to ours. So unfortunately, that's not something we determine at point of application, but you can absolutely have credits considered for transfer as you're matriculating.
Same. Transfer credit isn't guaranteed. We would only evaluate it after admission, and you could transfer up to 2 courses.
And Villanova is the same as well, 6 credits and would need to be reviewed at that time.
All right, looks like our next question is particular to the nurse anesthesia program. This is from Angela. Have students in any of the nurse anesthesia programs worked per diem during any portion of the program? As far as I understand, in the Jefferson program, there may be some students who may maintain very minimal work commitment per diem, which is, of course, as a nurse, if you have the opportunity for that, you could potentially maintain it. Of course, it's a very full-time, rigorous program. So our recommendation is to be fully dedicated to the program. But I believe there may be some students who may maintain that, but I don't believe it's recommended necessarily. You want to focus on the program as much as possible.
Yeah, for the anesthesia program, we strongly discourage working even per diem. You just really won't have the time or energy. And, even if you do have that day off, you usually don't want to spend it working. You either want to be studying or sleeping. So we strongly discourage it.
And the same from Villanova as well. Highly discourage it. Though some have probably done it, we do not encourage it. I'll take the next one. The application fee waiver is only for those applying to Villanova at this time. I don't know what Penn and Jeff were doing, but it would only be for Villanova.
We're not offering a fee waiver for attending this webinar, but if you do have concerns, just email us and we're happy to have a conversation about that.
Same for Jefferson, but we also do offer a number of other application fee waivers. Standard, if anyone is a Jefferson employee, for example, we don't pay to apply to Jefferson. So it's just one example, but yes, if anyone has any questions or concerns about applying, you can let me know as well.
Looks like the next question is for me. Is it common for those in Penn's midwifery program to sit for both the midwifery and women's health certification exams? Yes, it is. I don't have specific statistics, but most people sit for both exams.
The next question regarding undergraduate degree in psychology. Do not remember taking that special psychology class. Is it human development, or Jackie, is it your course?
We don't have a psychology prerequisite for our accelerate. If this question is for the accelerated BSN, I'm assuming we don't have a psychology prerequisite, so it won't be.
Yes, and if it's for accelerated, the BSN Express accelerated second degree nursing, then yes, it would be human development, which is the lifespan course, birth to death. And yes, it probably should be repeated if it was done that long ago, but I guess we would need to know if it truly was human development that you took before we could speak to that.
Our next question is about, for everyone, for all 3 schools, are online classes set up as the standard format or more of a Zoom format? So for Jefferson, many of our online courses are taught in an asynchronous format, although there certainly are times in a given course that are synchronized where everyone will log in with a webcam. I'm not sure if Zoom is the given platform that all faculty use. We have adopted Zoom as of the pandemic, but we have been teaching online courses long before the pandemic. So I don't know the exact format, but there are times even during the asynchronous courses where everyone does log in together for something that is more synchronous. So hopefully that helps a little bit. I'll let Cheryl and Jamie touch on that as well.
Yes, and at Villanova, it depends on the program itself. I can certainly get more information about how those are being taught at this present time, and then also how they may be taught in the future. But yes, we would have some synchronous, some asynchronous, some Zoom, some hybrid.
So our classes are traditionally in person. So during the pandemic, they've been offered in a synchronous Zoom format. Our programs that are have always been offered online, which is our postmaster's DNP and executive leadership DNP, are mostly asynchronous, but similar to Jefferson, there are some either courses or programs or lecture that might be required at a certain time.
Okay. Our next question is, oh, and for everyone, if there was an expiration time for previous master's-based classes like Patho and Pharm that were taken previously, I'm assuming this may pertain to if you're looking to possibly transfer them in. I'm guessing I may be reading this question incorrectly, but at Jefferson, if you're perhaps a postgraduate certificate student, you could potentially have your 3 Ps, Patho, Pharm, physical assessment that you took in your MSN considered for transfer. There would be time limits on that. I believe it's about a 5-year time limit. That is something that is also considered individually by the faculty if it pertains to transfer credit, as they're reviewing and making a plan of study for matriculating students. So hopefully I've answered that. If anyone does have very specific, I'll just put a PSA out here. If anyone does have very specific questions about individual like courses or transfer, just in case we can't get to everyone tonight, you're also welcome to email all of us those specific questions too. I don't know if Jamie and Cheryl want to add to that.
Yeah, pretty much the same.
Exactly, same with Villanova as well. And that would be more of a case by case, probably better to one-off it with an email and delve more into that.
Mm-hmm. Cheryl, the next question's for you about
yes, non-native
trying a TOEFL.
Applicants, so James. Yes, bachelor's degree from another institution. So James, depending on which program you're applying to, the TOEFL or IELTS may be required. However, if you're pulling any credits from your country, yes, we would need the TOEFL or IELTS. If we're taking all US institution credits, that would depend on the program to which you're applying. And that would be detailed on the website. So if you want to email me specifically which program you're looking into, I can get back to you with that direct answer.
Our next question, I think, is for Jefferson, pertains to the FACT program, our accelerated BSN. The question is average GPA. To be quite honest, I actually don't know because I don't work directly with the FACT program applications currently. So that is one you can also email me and I'll get you the answer. I would imagine it is 3.0 is the minimum GPA to apply, a 3.0 cumulative GPA and a 3.0 prerequisite science GPA. So it's certainly over that. I just don't know what the exact average is, but I can find out. And then Cheryl, the next question's for you.
From Rob.
Hybrid. Mm-hmm.
Yes. Okay. So Robert, yes. With regard, if you're applying by 10/1, that means that you're looking for May 2022, I'm assuming, for admission. Yes, you can still be completing your prerequisites at the time of application. And then we will just track you until that point. When you finish those, you will submit your official transcripts. So yes, you can still apply, still be finishing those courses while applying. Not a problem.
Cheryl, I'm seeing a question about our classes primarily a hybrid format because of the pandemic and what resources are available to students on and off campus.
So depending on which program, yes, it depends on the program and the course itself, whether it's hybrid. We do have in-person classes taking place at this time as well as Zoom classes, synchronous, asynchronous. And yes, right now this format that we're employing is because of the pandemic. Whether that stays on after things lighten up more, I'm not sure. But yes, we have faculty resources. You have an academic advisor when you come to Villanova. We have a lot of support offered. So that could be via Zoom for you, a phone call. In-person meetings are discouraged at this point in time, but definitely, you could share with us what you need and we could certainly try to help you in that way.
Just as a reminder to everyone, we will be sharing a recording of this webinar. So if you're unable to stay, the whole time or need to rewatch something within a few days, you should be getting that as well. It looks like the next question is for Jamie about what's the deferral policy. This person is going to be applying for the health leadership program.
So deferrals are not guaranteed. We encourage you to apply for the year you plan on enrolling. With that said, we understand things come up, life happens, pandemics occur. So if after you are admitted, you do want to explore a deferral, you just contact us and we'll work with you. I also see the next question is for me, asking about the prereqs for the direct entry program. I also see that it's 725. So just due to time, I'm not going to go over those in detail. They were discussed in the beginning of this presentation and they are online. And of course, you can email us if you have specific questions about that. And I see another question from James. For this upcoming fall term 2021, are the core courses set to be in person or will be hybrid / online? The $1 million question. If I could answer that, I probably would not be sitting here in my office working remotely. We don't know. And we probably will not know for another few months. The school is monitoring things day by day and is not rushing to make any decisions. So if you could just sit tight, you'll probably know if you are enrolling in the fall, hopefully by May or June.
The next question is, I'm assuming for all 3 schools, if you submitted an application but did not have all supporting documents in before the deadline, can your application be considered for the next open program or term? At Jefferson, that is dependent upon which program. For a program like nurse anesthesia, we do not roll applications forward to another term. That program is very competitive. You would need to reapply if your application is not considered. But for many of our other programs that have multiple start terms per year, yes, we are able to roll an application forward the next term without making you reapply, so you can complete your application and still be considered.
That would be the same for Villanova as well. Depending on the program, obviously, it would be a case-by-case basis. So happy to talk you through that.
We do not roll over applications, even for programs that have multiple start dates. We do give you about a week's grace period to get in your application materials, but if you weren't able to complete your application by that final deadline, we would not roll over your application. And it looks like the next question is for me. For Penn, would a GPA under 3.2 but above a 3.1 be considered without a GRE score? No. So right now for our MSN and anesthesia programs, the GRE is required if your cumulative BSN GPA is under a 3.2. We do not round up. And it looks like we're close to 7:30, so maybe we'll just take 1 or 2 more questions. Looks like there's a question from Robert. Can you discuss any government programs that offer tuition support in exchange for agreeing to serve professionally in underserved populations? Yes, so there is, Jackie or Cheryl can help me, but there are federal programs for nurses that do offer exchange for working in a federally qualified health center or a certain area for a number of years, will forgive your student loans.
I think it's the HRSA, HRSA.
Yes, thank you.
Yes, HRSA grant. So if you want to Google that, you may be able to consider some of those opportunities. That's true also for anyone pursuing, they have that at multiple levels, BSN, MSN. So it might be something to look into.
Exactly.
We'll do one final question maybe. So the last question we'll take then is, can you apply for the MSN during your BSN? So at Jefferson, we do require that your BSN degree be conferred. So actually completed and listed on your transcript in order to consider your application. We do have 3 start terms per year though. So if you don't make it in time for one term, you can try for the next one. But yes, we do require that your BSN be completed. Jamie or Cheryl?
For Penn, for the PhD program, because you can go in right after your BSN, and for our primary care programs, you can apply during your BSN as long as you will graduate and pass the NCLEX before you enroll in our programs. For our acute care programs that require work experience, you will need to have that minimum work experience before you apply.
Yes, and for Villanova, they would like to see the BSN conferred before moving into the MSN program.
Okay. And with that, it is 7:31, so good timing for all of us. Just want to thank Jackie and Cheryl for doing this and putting this together, and for everyone for tuning in. Again, we know it's a lot on a Monday night to sit and listen for an hour and a half. Please email us if you have any questions. The recording will come from the same Penn email that you've been getting the reminders from, but we will have everyone's contact information in there. So please make sure to reach out to everyone if you have specific questions. Jackie or Cheryl, any final thoughts?
No, thank you so much, Jamie, for assisting us with organizing this, and it was wonderful to work with both of you.
Yeah, and we look forward to hearing from all of you. If you have further questions, please stay in touch with us. Also, I know most of you out there are probably nurses working in the field, and all of us have been very lucky to be safe and at home for this past year. So from all of us, we just like to thank you for your work. We hope you're staying safe and healthy out there, and we want to hear from you. So please reach out if there's anything we can help with. And thanks for your time tonight.
Thank you, everyone.
Yeah.